everyone. Welcome to Banu Pratibha Lectures. Today we will be seeing an interesting topic in neuroanatomy, that is cranial nerves. But before going into the topic, don't forget to like, share and subscribe to our channel Banu Pratibha Lectures and click on the bell icon for more updates. Now let us see what are cranial nerves. Cranial nerves are the nerves emerging directly from the brain, and these are like power line connectors between the brain and the body with specific functions like sight, smell and even digestion. Other set of nerves are spinal nerves, which are arising directly from the spinal cord. So do you know how many spinal nerves are present? If you know, do leave it in the comments. There are 12 cranial nerves present in the body, and they are as follows. The first nerve is called the olfactory nerve, second is the optic, third is the oculomotor, fourth is the trochlear, fifth is trigeminal, sixth one is called abducens nerve, and the seventh one is called facial nerve, eighth one vestibulocochlear nerve, and the ninth one is called glossopharyngeal, 10th is vagus, 11th is cranial accessory and spinal accessory nerve, simply called accessory nerve, and the last but not the least is the hypoglossal nerve. I find it very tricky to remember all this when I was a student as well. So we can use a mnemonic to easily understand and remember the order of the cranial nerves. The most common mnemonic used is OOO, towering top, a Finn and German viewed some hops. So the OOO represents the olfactory, optic, the oculomotor nerve, and here it forms the towering top is for the trochlear and trigeminal nerve. A Finn, A refers to the abducens nerve, F is for the facial nerve, and the A here is for the auditory nerve, which is also known as the vestibulocochlear nerve because it consists of two nuclei, the vestibule nuclei and the cochlear nuclei. V is for vagus, S is for the spinal accessory nerve, and H is for the hypoglossal nerve. Now let us see what are the functions of each nerve and where it is supplied. The first nerve is the olfactory nerve. The olfactory nerve is a sensory nerve which is for smell, and it is going to supply for the olfactory epithelium present in the nose. And secondly, we have the optic nerve, which is also a sensory nerve which is going to supply for the retina of the eye and is responsible for the vision. Thirdly, we have the oculomotor nerve. One thing we need to know about this is there are three nerves specifically for the movements of the eyeball, that is oculomotor, trochlear and abducens nerve, which is the third, fourth and the sixth nerve. So the oculomotor, as the name suggests, it is a purely motor nerve which is going to supply for the muscles of the eye for the movements of the eyeball, except for two muscles, which is lateral rectus and superior oblique muscle. And then we have the trochlear nerve, which is the fourth nerve and also the longest course of the cranial nerves, and it is going to be purely motor and it is going to supply for the superior oblique muscle only. Then we have the abducens nerve, which is the sixth nerve, which is going to supply for the lateral rectus muscle, and it is going to be supplying for the eyeball as well to move side to side. The abducens nerve is also known for the abduction of the eye. So totally these three nerves are essentially used for the purpose of the movements of the eyeball and also for the sphincter, the pupil and accommodation of the eye. Then the fifth nerve is the trigeminal nerve, which is a mixed nerve which is having both sensory function and as well as motor function. The sensory function is it is going to give the sensation for your face. So a pinch in your cheek or a slap in your cheek is by your trigeminal nerve, and it is also helpful for the motor movement of opening and closing your jaws. Next, we have the sixth nerve. We saw already it is abducens nerve, and seventh nerve, an important nerve, is the facial nerve. The facial nerve is also a mixed nerve which is having both sensory and mixed action, motor action. The sensory part is it is going to supply for the anterior 2/3 of your tongue, whereas the motor part is going to be your facial expression. The frowning, the smiling, the winking, the chewing, all these are by the facial nerve. Next, we have the vestibulocochlear nerve, also known as the auditory nerve. So as I said earlier, it has two parts, the vestibule part and the cochlear part. The cochlear part is going to supply for the organ of corti or the organ of hearing, and hence it is going to aid in hearing. Whereas the vestibule part is for equilibrium and balance, and hence it is called vestibulocochlear nerve, and it is sensory in function as it is helping in our hearing. So it is also known as auditory nerve. Ninth nerve is called the glossopharyngeal nerve. As we saw for the eye, as eye had three main nerves for its movement, we have two important nerves that's main supply is for tongue. One is glossopharyngeal nerve, the ninth nerve, and the 12th nerve, hypoglossal nerve. The glossopharyngeal nerve is again a mixed nerve which is also having the sensory part and the motor part. The sensory part is going to be for the posterior part of the tongue. Now you can say, where does the anterior 2/3 part of the tongue is supplied by? It is supplied by the facial nerve, and in the motor part, it is helping for the swallowing of food. And in the sensory, it is also going to be supplying for the salivation, the important salivary glands, submandibular gland and sublingual glands. And the hypoglossal nerve is for the supplying for the muscles, intrinsic as well as extrinsic muscles of the tongue, except for palatoglossus muscle, which is going to aid in the tongue movement. So what nerve supplies the palatoglossus muscle? A thing to ponder. Now let us see what is vagus nerve. Vagus nerve is again a mixed nerve which is going to be motor for your muscles of the palate, pharynx and larynx, and it is going to be sensory for the thoracic and the abdominal viscera. Then we have the spinal accessory nerve, which is going to supply for two important muscles in the body, that is called trapezius and spinal accessory nerve. So these are motor, entirely motor, and it is for the head and neck conjugate movements. Hope you have understood the topic. Thank you, and don't forget to like, share and subscribe this video.